Hello everyone, this is Dr. Mehta here from Mumbai, and in this video we are going to be discussing about stress urine incontinence. If you remember, in our previous video we broadly mentioned what is incontinence, and we also mentioned about what are the different types of incontinence. In this video we are going to focus specifically on stress urine incontinence. As I mentioned, remember, the urine bladder is a very important organ, and in a normal lady, it is a continent organ. That means whenever the lady wants to hold urine, be it due to a social cause, be it due to any other cause, she is able to hold the urine. That means if you want to pass urine, but you have, let's say you have another 15 minutes or 20 minutes before you reach the washroom, but you want to hold on to the urine, you will be able to hold on to the urine. This is in a normal lady. What happens is, whenever we are talking of stress incontinence, there is something called as a trigger factor. That means there is something which increases the pressure inside the abdomen. Now this could be coughing, jumping, laughing, sneezing, and various other activities which make the abdominal muscles contract. So in a normal lady, what happens is, when the abdominal muscles contract, there is something called as a sphincter. So there is something called as a gatekeeper which is present at the bladder exit. That also contracts and it holds the urine. In women with stress incontinence, that gatekeeper, that sphincter, becomes defective. Now because this sphincter becomes defective, it is not able to hold on to urine in such situations, and due to which there is an involuntary leakage of urine when the lady is jumping, dancing, sneezing, coughing, or in all these activities. Remember, because it is an involuntary passage, that means the lady doesn't know that the urine has leaked out. She realizes the urine has leaked out only once it has leaked out. That is the reason why it is very, very distressing for any lady to have this problem. There are various causes which cause a sphincter to become defective, and as I mentioned, one of the most important cause which we must try and look out for is a traumatic normal delivery. That means a normal delivery which was assisted with either forceps or with either vacuum. This could be an event which would have occurred, let's say 10 years back, 5 years back. These women usually tend to develop stress incontinence. The other causes could be a generalized weakness in the fascia. No one knows why it happens, but it happens to a lot of women. The other causes to that could be obesity, extreme weight gain. When somebody gains a lot of weight, the muscles, especially the bladder muscles and the sphincters, tend to become weak, and that causes involuntary leakage of urine on doing these strenuous activities. Apart from this, any condition which stimulates chronic cough, like lung problems, any condition which stimulates chronically increased intra-abdominal pressure, like chronic constipation, all these are known medical causes for developing stress incontinence. Now, if you actually look at it, quite a lot of times when we discuss urine leakage with women, they normally tell us that, doctor, I leak around 1 drop of urine or maybe 2 drops of urine. See, whenever the leakage is so minimal that it is just 1 drop, it is just 2 drops, these are the type of patients who can be easily managed by little lifestyle modifications and physiotherapy. When I say physiotherapy, it is going to a physiotherapist and doing Kegel's exercises. That means the exercises which helps you strengthen your pelvis muscles. It is not looking up onto Google and doing Kegel's exercises on your own. That really doesn't work. You need to go to a physiotherapist. They need to examine the muscle tone, and once they examine, they will make you do these Kegel's exercises for a period of over 12 weeks. That means for over 3 months. And if you do that correctly, this 1 drop leakage of urine, 2 drops leakage of urine, all this can be managed. If the problem is more severe, that means if on single sneezing episode there is a little more than gush of urine, that means enough to soil your clothes, enough to stain them, in these situations, remember, no matter what form of therapy you try, no matter what form of medical management you try, ultimately you are going to need a surgical correction. And this surgical correction typically involves placing a tape on the mid-urethral aspect. We've shown this in some of our YouTube videos, but that's the surgical aspect. It's too technical. You must remember that the surgery, when done by an expert and done correctly, is usually going to give you a virtually 98 to 99% cure rate in this problem. And within the flash, that means as soon as the surgery is finished, within a day, the lady again becomes continent. And I think that is the biggest advantage of doing a correct surgery for a lady who has a genuine stress urinary incontinence. The most important thing before I conclude, this is a socially distressing condition, and as a result of this, normally women don't open up with these conditions to even their family members. To all people who are watching this, I strongly encourage you, especially if you are patients, to open up regarding this condition to your doctors, to your family doctors, to your family members. I'm sure they will guide you correctly, and definitely you will have a curative surgical management if need arises in this condition. There could be a lot more questions regarding this, which you can post in our comment box. Me and one of my team members would try to get back to you as quickly as we can. Thank you so much.